Good evening. This is a presentation by Monique Samuel for Nursing 620. The topic is Self-Care Deficit Nursing Theory by Orem. Orem meta paradigm defines the person, health, and environment as well as nursing. Basically, she describes the person as a total being in nursing care, capable of self-care. Health as being sound and whole in body and mental. Environmental, she describes the physical, chemical, biologic, and social context within which human beings exist. Nursing, she describes as supplemental therapeutic self care. And that self care can be given whole, part, or in a supportive educative system. The self care deficit nursing theory is Orem's grand theory. Is composed of three interlinking middle range theories: self care deficit, and nursing systems. The theories are applicable when the demand of self care is greater than the individual's ability to satisfactorily attain it. Basically, a deficit in self care requisites bring about a need for nursing care. Self care is described as activities that human beings innately desire to complete or assist with in order to maintain life and or gain a higher level of well-being. These actions are deliberate requisites to supply or ensure the supply of necessary materials needed for continued life, growth, and development and maintenance of human integrity as defined by McEwen and Wills in 2014. Self-care requisites are categorized as universal, developmental, health deviation, and self-care agency. Universal self-care requisites that they consist of basic life requirements such as air, food, elimination, activity, rest, social interaction, as well as solace. Developmental self-care requisites occur due to a health condition or life event, and it includes disease processes, injuries, effects related to aging as well. Health deviation requisites are actions necessary to employ help when a deficit in self-care exists, such as procuring mental treatment and nursing interventions. Self-care agency is the ability to engage in and or perform fulfillment of self-care activities. And of course, a part of that is the therapeutic self-care demand, which is the combination of actions necessary to meet the prescribed self-care activities in a period. Agents provide care. Dependent agents receive care. The agent utilizes appropriate and validated measures. If the agent is a nurse, of course, it's evidence-based, but the agent basically utilizes appropriate and validated measures that are identified by the self-care requisites. Self-care deficits occur at the point of the inability to meet their self-care fundamentals. These self-care activities are influenced by conditioning factors such as development, age, sociocultural factors, health, and education. The theory for nursing system recognizes the self-care needs and identifies actions that can reduce or eliminate deficits through the nurse-patient relationship. ARM discusses three ways the self-care requisite can be accomplished through the nurse-client relationship. And of course, we mentioned that whole or part compensatory system or resource supportive and education system. Nurses make judgments and recommendations for interventions and adjustments through the nurse patient role. So, what is the significance of self care deficit nursing theory and patient outcome with the utilization of simplified heart failure education? I'll start by just talking about heart failure. Unfortunately, heart failure has no cure. It is proven that people with this condition can lead a full and positive quality of life when the symptoms are medically managed, coupled with the patient receiving education that meet them at the level of their understandings and their readiness to learn. Overwhelming a hospitalized heart failure patient with detailed discharge instructions is not meeting the needs of the patient at that time. Current discharge instructions consist of a rather detailed explanation of the disease process, the importance of adherence to medication, scheduled medical follow-ups, multiple lifestyle adjustments, as well as being aware of outpatient community resources. These intricate aspects concerning lifestyle changes that these patients must commit to must be implemented gradually from the time of admission and continue through the transition from the hospital to home and until death. This multi-level, substance-filled, and most times overwhelming education process cannot be condensed over the 2 to 3 day hospital stay that is geared towards improving their failing condition. Health literacy for heart failure patients, self-efficacy, and self-care is directly related to the success of their overall outcome. Keeping medical appointments, adhering to medication regimes, and following advised lifestyle adjustments entail that the patient comprehends the subject matter in a way that allots for prompt retrieval and utilization. Health literacy is the ability to acquire, sort out, and comprehend medical evidence, enabling an individual in making an informed decision about health care. It requires the use of knowledge and communication skills to perform health-related tasks. And this was defined by DeWalt in 2010. Each encounter with patients is an opportunity and should display and embody these necessities in the promotion of maximizing the patient's outcome with education. These encounters may include education on the patient's disease process, lifestyle adjustments implemented during hospital stay or once they get home, medication regimens, new or old, or if need be to incorporate new and old medication regimens, follow-up requirements, as well as community resources that may address socioeconomic barriers and psychosocial stressors on a level of their immediate comprehensive ability. Heart failure education that includes the teach-back method and a condensed must-do list should allow for comprehension, add to self-efficacy, and encourage self-care. The objective of this proposed investigation is to analyze hospital-given education for heart failure patients, challenge its appropriateness, meaning its level of health literacy required to comprehend for its population in time of delivery. Then to establish strategies to incorporate simplified, standardized methods of heart failure education to patients. This proposed study is to promote the ideology that patient education should be geared towards its audience and gradually implemented from the point of admission, and is to continue through the patient's hospital stay to the transition to home and confirmed with follow ups while improving adherence.